Morning, Central New York. Hopefully you guys are having a great day today. I wanted to do a video specifically today on spinal health. I have so many people, as a chiropractor, you have so many people that view chiropractic as taking care of the spine for spinal conditions, neck pain and back pain. And that's this much of what chiropractic is. But because it is such a common thought with people, I wanted to address that and why that's so important. So before I do, let me ask you, if you like our videos, I want you to share them and like them. Make sure you like the video and make sure you share them with a friend or a colleague. Post them on your work, some of your work sites. I know there's so many people doing virtual things right now. Try to help somebody else out because there's so many people that suffer from these problems and they don't know where to go. They don't really have the right information, and sometimes we're trying to get our doctorate on Google. You know what I mean? And I mean that respectfully, but rather than really getting all the information, we get bits of information. So have them share this. I would ask you to share and like the videos and share them to a colleague. So we've talked on our videos a little bit about this, but let's talk about that. I've got spinal problem. Let's say you do. Let's say you got spinal problems, you got degenerative problems, you got arthritic problems. You hear about pinched nerves and degenerative nerves and degenerative disc, and stenosis and spondylosis and all these words, and what do they all mean and what's happening? So before I answer that, let me ask you a question. If you have a car, right, and you drive your car and you never line the car up, you never bring it to the shop, you never bring it to get the wheels balanced, you never get the front end alignment, you never do anything, and you just keep driving thousands into 10,000s, into 10 and 20 and 30 and 40, 50,000 miles or whatever. Think about what's going to happen to the car. Like if you own something and never wash it, if you have teeth and never brush them, if you own some piece of machinery, think about your house. You have a house. You have a furnace or some type of a heating system in there. You never change the filter. You never take care of it. What's going to happen to it? I want you to think about that. Because what's going to happen to it, as we all know, it's going to break down. So whether you got a car, whether you got a motorcycle, whether you got a boat, right, which needs endless maintenance, right? Whether you got a furnace, an air conditioner, right, a roof, everything has the strain and stress on it to break stuff down because of the elements of weather, because of how it's used, because it's banged around all the time. So I think we need to own that first when we start talking about the spine. Because what we forget is, we tend to think, well, if it doesn't hurt, it's okay. But we tend not to do that with other things in our life. And the other problem is you can't see your spine. You don't feel it often unless it starts to really break down and hurt. So use the example of the teeth and the toothbrush for a minute. If I never brush my teeth, what's going to happen to them? Right? Some of you probably know firsthand. Some of you know they're going to break down. They're going to get sick, diseased, right? Gum disease. They're going to start bleeding. Bad things are going to happen in my teeth, right? So if bad things start happening in my teeth, if they start happening because I haven't brushed, and I say, hey, it's time to start brushing. I mean, good news, you'll probably stop it from getting worse, but I've already got a lot of sickness and disease that's developed on my teeth. You see, your spine is exactly the same way. It's made of all these little joints. And there's 4 joints to most of the vertebrae. So you got all these joints in your spine, and the spine is constantly under stress. It's just like plaque on your teeth. Your spine's always going to go out of alignment. It's not if it goes out of alignment. We often think or have been taught that your spine, if it hurts, it went out of alignment. That's not accurate. It's like if your tire blows on your car, right? If your tire blows on your car and you're like, oh geez, I'm out of alignment. Like it took a long time for the tire to wear improperly for the bearing and the tire to break. So the same is true with your spine. By the time you say, hey, my teeth don't feel so good, it's been years of neglect. So the same thing with your spine. When somebody comes in most cases and say, geez, I feel horrible right now. It started Wednesday. We tend to think, well, something must have got kinked out of alignment on Wednesday, and that's when I hurt. And in reality, it's years of neglect that's led you to have the problem. It didn't just start yesterday. Very similar to heart disease, right? I mean, heart disease, if I have a heart attack, it's years of neglect that caused me to have the heart disease. It didn't happen Wednesday when I started having the heart pain or the chest pain. So when we look at stenosis and spondylosis and bulging discs and such, we need to stop for a minute. Stop and think, wait a minute. Rather than treat something, maybe who do I know or what profession takes care of the spine, takes care of it, renders care to it, tends after it, looks after it. And that would be chiropractors. You see, like if I had a tooth problem, cardiologists are phenomenally well trained, and we've got the best in our country, right? But I wouldn't go to the cardiologist if I had a tooth problem. I wouldn't go to the cardiologist if I had a foot problem, right? I go to cardiologist if I have a heart problem, right? Or if I have a tooth problem, I'm going to go to a dentist, and then I'm going to say, hey, doc, why'd my teeth get back? And he's going to go, hey, Dr. Borio, you haven't been brushing your teeth. I'm like, you're right, I haven't been taking care of them. So I'm going to fix that tooth, but my advice to you is now you're going to get in here a few times a year, and you're going to use one of these things a couple times a day along with flossing, and then your teeth are going to stay healthy. We got to think of it exactly the same way with our spine. You see, this needs to be taken care of regularly, right from a little kid, like you would brush their teeth right when they get a tooth. So when you're born, you get checked for alignment, because most children are out of alignment right when they're born. And then throughout your life, you get in here regularly to get the spine checked and aligned. And what that does is, one, you're going to feel better, which is great. Two, your body's going to function better. Three, your nervous system is going to work better. The messages, right? It's tough for your brain to talk to your body through a crooked spine. Doesn't work as well. I think most people can understand there's no health in crooked. Four, what's going to happen? My spine's not going to deteriorate and it's not going to degenerate. Now, if you already have it, like if I already have a couple of bad teeth, I have people say, well, geez, what's the point now? Would you say, well, I'm not going to brush? No, you'd say, Jesus, I got to get these 2 teeth fixed, but I better start brushing and flossing the rest of them, or the same thing. Hi, Amy and Wendy. The same thing's going to happen to the rest of them. So the same is true with your spine. Like, don't look at what I do as a treatment for herniated discs and bulging discs and all that other stuff. My job is to take care of the spine irrespective of what you got going on in there. So the spine always needs to be tended after. It always needs to be cared for. And the research shows that and this probably isn't a big surprise, but if you're going to a chiropractor regularly, so if I take thousands of people that go to a chiropractor, and I take thousands of people, just randomly take pictures of them, right? The people that are under regular chiropractic care, guess what? They have less arthritis. Their spine works better. Not only that, their overall health is better. Their lungs work better, their kidneys work better, their organs work better. Why? Because all the messages in your spine go to all the organs. So the organs and body parts work better. So that's what we found. And I don't think it's shocking if I said, hey, listen, if I took 1,000 people that brush their teeth regularly, and I take 1,000 people that don't brush their teeth regularly, who's going to have healthier teeth? Hey, Jerry, who's going to have a better life? Who's going to live longer, right? The more diseased your teeth are, you're more prone to pancreatic cancer, you're more prone to heart disease. I don't know if you guys read that research. It's crazy, right? So listen, the more adjustments that you get periodically throughout your lifetime, the healthier your spine is, the better your life is, the longer you're most likely going to live, the level of disability is less, the amount of medication you take is less, the likelihood of needing surgery decreases dramatically. They did a study in Illinois in the 90s, and they allowed chiropractors to be everyone's primary care, and they compared that to people that didn't use their chiropractor as a primary care doctor. Guess what happened? The people that were using their chiropractor as their primary care doctor under Blue Cross Blue Shield lived longer, less disease. Their amount of prescription and non-prescription drugs went down 70-80%. That doesn't mean drugs are bad and you should never take surgery. What it means is, hi D, what it means is this: if you're healthier, you're less likely to take drugs. If you're healthier, you're less likely to have and need surgery, right? So the reality is, getting in here and taking care of you rather than treating you is a better way to live. For you and your children. You got to get the kids in here. Now, listen, I know some people say, I don't have time, and finances are problems for people. I get it. I understand it. We do a $37 checkup for you and your family. I give it away. Why? Because I don't want money to be an obstacle. Number two, my attitude is this: if you come into my office and you're like, hey doc, here's what the recommendation is, but I can't do it, what can you do? I mean, my attitude is doing something is far better than doing nothing. So if that is the situation, let's figure it out. Let's figure out what we need to do in order to at least allow you to get some care rather than no care. Some care is always better than no care. But listen, I'm done with looking at people getting sick and disease. That's why I just do these videos. It's like, guys, if you get in here and start taking care of yourself, your overall health is so much better. And so many people now, they're sitting at home, they're on a computer on their kitchen table, their neck's killing them, their spine's killing them. I'm talking about being crooked. Talk about their spine getting sick and diseased. Talk about you getting healthy. It's horrible for all of us. It's not the way to do it, not to mention all the stress we're under. So listen, call our office today. Hit the link above or below. Or you can go right to our website, Cooking Italian with Joe, or that's my other site, BorioChiropractic.com. And you go right on there and you could text us from the website. You could call us, do old school. You could do whatever you want. You could set up an appointment right from the website, right into the office. And my staff, I've got Lisa, I've got Floria, we've got Paige, Leanne. We've got the best team of people that love you and care about you and want you to be well. I know that's what I do. I've been at it 29 years. I could have stopped a few years ago. I come in every week for one purpose. Not an ulterior motive. I come in to help you guys out. I come in to inspire you. I come in to lead you. I come in to make your life better. And I know the people that take care of themselves and the families that are in here are always the healthier families. And that's what I want for you guys. So, hey, love and appreciate you guys. Have a wonderful day. Have a blessed day, right? Live your life with some fun. Live your life with some passion, right? Get out there. Big virtual hug coming in from Dr. Joe Borio. I wish I could do virtual adjustments for you, man. I would adjust everybody. I wish I could. But unfortunately, you got to get in here and let me get my hands on you and get you adjusted. So have a wonderful day, guys. I'll talk to you on Wednesday.